Pop back up. I don't need to see myself. So welcome everyone to this Introduction to Motivational Interviewing class. I have presented on motivational interviewing for the Empower Idaho programs several times over the past several years. And usually I'll do a longer presentation that's usually about 2 hours. This is a shorter one. So I took the same material and tried to consolidate it down into 1 hour and so give everybody a good overview of motivational interviewing and also give you some ideas about how you can incorporate this into your work with your peers. So a little bit about myself first, if you're wondering who I am. So I'm a clinical psychologist. I'm originally from Oklahoma. I did my graduate training at the University of Colorado in Boulder. I learned a lot more about being a health psychologist whenever I did an internship at the University of California, San Diego's Department of Psychiatry back in 2012, and also in a place where I learned more about motivational interviewing. I moved out to Boise in 2013 to do a postdoctoral fellowship in primary care mental health integration. And after my postdoc, I started working at St. Luke's in 2014, did a number of different things. I started specializing more in health psychology, specifically behavioral sleep medicine. I also currently work with the St. Luke's Lifestyle Medicine Clinic, where I teach health education classes and health behavior change classes. So regularly using motivational interviewing and the work I do there. And then I also have a private therapy practice where I spend about half of my time called Confluence Health Psychology that I've been, I moved that out of St. Luke's just about almost at my 1-year anniversary. And yeah, so I do therapy and I teach health education classes, and then I, sometimes get the opportunity to do these kinds of presentations. And I love to teach, and so it's really fun for me to be able to teach these kinds of classes. And also I'm doing the next class this afternoon on personality disorders. So we're going to do a huge shift in direction and talk about an overview of personality disorders, and that will be a fun thing to teach as well. So if you have any questions for me as we go through the presentation, like Alejandra was saying, you can type them into the questions box. I use this question box like you would use a chat box in other types of presentations. So I use it as a way to interact with folks and give you a way to interact with me whenever, we've got 50 some people here right now. So I try to monitor that as well as I can. And yeah, to answer your questions, and I'll be asking you questions as well too. And so that would be the appropriate place to respond to those questions. All right, so we've got a lot of stuff to talk about in the next hour. So we're going to talk about the spirit and history of motivational interviewing. And the spirit of motivational interviewing is super important. And one of the things I found about working with peer support specialists is so much of this comes naturally to you, which is really cool to see. And then in part 2, we'll talk about engaging with peers and listening skills. In part 3, we'll talk about what we call core interviewing skills and the importance of exploring values or understanding, well, first off, what we mean by values and how you can better understand your peers' values and incorporate that into trying to help them. And we'll wrap things up talking about intrinsic motivation and how you can get the people you're working with to state their own reasons for change. And then we'll talk a little bit about, once they're ready for that, how you can, some things to keep in mind when you're helping them come up or set goals for themselves or come up with plans for that. All right, so in this first part, we want to talk about the definition of motivational interviewing, factors associated with behavior change, and common communication styles in healthcare and just real life, and how that can affect behavior change. All right, so I'm going to do, Alejandra probably forgets this part where I make her do a role play with me. Alejandra, do you remember doing this before?
Yes, and I'm ready.
Okay, cool. So yeah, I've got you trained at this point. So basically what I want to do is model not motivational interviewing first and, let you kind of feel what you're feeling when I do that. We'll talk briefly about that, and then I'll come back and try to do a better job at using motivational interviewing skills, just to kind of highlight the difference in communication and what that would look like. So let's imagine that I'm a new peer support specialist, and I am super eager to help my new peer assignment with her symptoms of depression in this case, and avoid losing her rental. So I'm talking to Alejandra, and I'm saying, Alejandra, you know what? I have been in your situation before. I know what it feels like to be depressed. I know what it takes to get yourself back on track. And so, some of the things that I need you to do, first off, you've got to find a way to not avoid losing your rental. You don't want to go back to what you've done before. And I mean, Alejandra, are you afraid of losing your rental?
Yeah, I'm afraid of losing it. But there's so many pieces to it that I don't even know where to address the issue.
Sure. Well, I've been here before, and I know exactly what you need to do. So, the first thing you need to do is you've got to keep your job. You've got to get back to work. You can't keep calling in sick. You've got to go there. You've got to keep that up. That's the first thing you have to do. And so that's probably enough at this point to get a feel for the angle that I was taking on this. You probably noticed that I basically did all the talking. And so what are people's knee-jerk reactions to the way that I'm talking to Alejandra and I'm telling her what she needs to do to avoid losing her rental? And be honest with me here.
Cringe.
Yeah, I feel cringy whenever I'm doing that, Laura. Yeah, it's totally one-sided. I'm not giving her any choices. Yeah, I'm too much. Yeah, come on, Kyle, give her some resources. It's not peer directed. I'm shooting all over her. Yeah, maybe helpful. Certainly not supportive. Yeah, the only thing I'm doing is telling her what she needs to do. I'm not listening. She knows all this. Yeah, if anything, I'm making her feel ashamed. I may be making her defensive. You all know this so well that it's like the opposite of a peer-led approach. And so all of your alarm bells are going off for good reason, right? This is not a helpful way to help somebody, though, when somebody's being they're just so eager to help somebody and they're kind of naive, it's easy to fall into this advice giving kind of trap. And, from my perspective, when I think about being this person in this role play, I'm assuming I have dealt with depression. I have been in this situation before, where I had to figure out how I was going to keep working when I was depressed to avoid losing my rental. But still, even if I have that lived experience, that is not what Alejandra needs to hear from me in that kind of situation.
Yeah.
Okay, yeah.
That was messed up, Kyle.
Yeah, that was messed up. That was totally unhelpful. So so what I was trying to do, telling her what she needs to do, telling her how she's going to do it. And yeah, like I said here, we've got your reactions and none of them are good. My favorite one was probably cringe. That probably says it all. This is antithetical to what you all have been learning in terms of being a good peer support specialist. So if you were Alejandra, would you be more or less likely to change the behavior now after I just got done telling you everything that you needed to do?
Yeah, my behavior would change, but not in a good way.
You're like, well, the first thing I'm going to do is get rid of this peer because I don't need anyone else telling me what to do in my life. So let's switch things up a little bit, and I won't spend too much time on this, but I'm going to put on my motivational interviewing hat, my good peer support specialist hat, and then we'll see what you think of that. So Alejandra, I heard you're having a really hard time recently, and I also heard that you could be in danger of losing your rental right now. I'm curious, like from your perspective, what's going on here, and what do you think you need to do to help yourself?
I mean, I don't know where to start. I feel like getting out of bed in itself is really difficult. So I call into work, I'm not getting my full paychecks, and that obviously filters into why I'm not able to pay for my rent. And it just feels like too much. I don't know where to start.
Yeah, it sounds like you're having a hard time with your mood right now. Um, I'm curious, have you ever felt or been in a similar situation and able to do anything or help yourself feel better in similar situations in the past?
I mean, sometimes I like to go out on walks and hang out with friends, but right now that just doesn't feel like something I want to do. The friendships that I've had are people that are in a circle that is negative for me, and so I just don't feel like I have anyone.
Yeah, I feel like I've been in similar situations before. Would you be interested in learning about what I've done to help myself in times like that before?
Yes, please.
Okay. I think, like you said, reaching out to friends can be really helpful. And I'm also curious, like, do you have any mental health support right now in terms of other people that you can talk to, like a therapist, a counselor, anyone like that in your life?
Not really. The first step that I took is connecting with the peer support, and I heard that they can help with creating a game plan, but I don't really know what that looks like.
Sure. Would you like me to help you find somebody else that could potentially help you with therapy or maybe even medications for what you're dealing with?
Yeah, I'd be open to that conversation and connecting with those people.
Okay. So I'm gonna wrap it up right now. So, like, what did people notice that I was doing differently this time instead of the first time around? And how did it feel like if you were being that person? Yeah, I was letting her talk. I was asking open-ended questions. I was using active listening skills. Yeah, you picked up that I was validating what she was saying. Hopefully, you didn't think that I sounded frozen, Deborah. uh, yeah, and then one of the other things. Yeah, yeah. So Brandy just picked up on this. Yeah, and Ellen saw the same thing. Like one of the things that I was doing a lot was asking her for her permission. Like maybe I do have helpful things to tell her, but I'm not just straight up telling her that. I'm asking her if she wants to hear what I have to say about it. And things that really changes the spin on things, because now I'm giving her information that she's kind of asking me to give her instead of me just assuming that I know what's going to be best for her. And my recommendations may or may not be the best fit for her, but at least she said that she was curious about what I had to say. So yeah, hopefully you picked up on some of the differences there, and hopefully it felt um, less cringy than or hopefully not cringy at all this time around. And that's the kind of thing that we want to really shoot for here. Get to know the person that you're working with and help them come up with their own plan. Um, Once again, I feel like the training you all do and probably just your natural inclinations makes it easy to the spirit is almost like inherent in the kind of work that you're doing, which is different than in other kinds of settings. That I do these kinds of trainings, like in healthcare settings. Like if I'm training physicians, they don't yeah, they don't always do what you all are saying. Um, so what is motivational interviewing in the first place? So I always think that this is kind of cringy too, but it's kind of a funny cartoon because sometimes like whenever I present in those kinds of healthcare settings, people think that motivational interviewing is basically a way to make people do what you want them to do, which I do not agree with. I feel like that's unethical. Though maybe what I would hope for somebody also aligns with what they want to do for themselves, and then that's a really good fit. So let's look at a formal definition of motivational interviewing. So this is a collaborative, goal-oriented style of communication with particular attention to the language of change. What we mean by that, I want the person I'm working with to talk about change, why they want to have change in their lives, and what they would do if they were going to change. That's what motivational interviewing is all about. So it's designed to strengthen personal motivation for and commitment to specific goals by eliciting and exploring the individual's reasons for change within an atmosphere of acceptance and compassion. And once again, that's probably some of this stuff it's hard to teach people acceptance and compassion. That's kind of more your personality to a certain extent. But once again, I feel like peers are, if you're signing up for this kind of work, that probably comes pretty easy to you, or maybe it's something you've cultivated over time. So what motivational interviewing is not, it is not just reverse psychology. It's not just getting people to do what you want them to do. And it's not something you do to another person. You don't say, I'm going to go motivationally interview this person. It's really a style of interaction with someone. And it's also not, one of my physician friends, he's like, it's like judo. It's like mental judo. You just get them to do what you want them to do. And I'm like, no, yeah, once again, hopefully what you want for them is in their best interest and you're aligning. But it's not just what I want to do. It's helping the person do what they want to do. So yeah, which I'm just checking the comments, like Stephanie just said, self-discovery is key for me. That's what motivational interviewing, like I don't have an agenda other than I'm trying to help somebody figure out why they would want to make a change. So 4 processes of motivational interviewing, and these are sequential, are engaging. So I want to engage with my peer and form a relationship with them. I want to focus on specific areas that we're trying to affect change in. And then we move on to, once we know what we're trying to help them with, we move on to evoking, or getting them to talk about what they would want to be different in their lives. And then once they're talking about all that, then we can move on to planning. And it's important to stay in that order, because you probably saw in that example, like with Alejandra, I was like jumping straight into planning. I said, this is your problem and this is what you need to do. And I was like way ahead of her, and I'm not helpful to her at all in that moment. She doesn't even like trust me at that point. And so once again, doing these things in order can be incredibly helpful. So I always feel like I've got to do a little bit of explanation of where motivational interviewing came from in the first place, because that can be really helpful and for people to understand kind of the context of this. So motivational interviewing originally developed, it's as old as me, as 39 years ago, as an intervention for alcohol dependence. And the way that they came about this, it's pretty interesting. So they were looking at an intervention for alcohol dependence, and they had like a therapeutic intervention in one part of the study. And then in the other part of the study, what they said is, we're just going to show these people like basically their lab values and show them how they compare to the rest of the population. And also just like some norms, like so basically, it's like, oh, you're in the 99th percentile of people that use alcohol. You drink 99% more than other people. This is where what your liver enzymes look like compared to other people in your age range. Once again, it's like you're in the 99th percentile or something like that. So you're just giving them objective information about how their health, their behaviors compared to the normal population. And what they found in this study, stumbled across this, is that the control condition was equally as effective as the fancy therapeutic intervention. So how interesting. So one perspective is you could say, well, neither of these things worked. Or you could, well, they actually did see that they worked, and people started reducing their alcohol use. And so what they realized was just giving people objective information about what they were doing had a big impact on their behavior. because people started figuring out why they wanted to change for themselves once they realized some of the problems that they were starting to run into or were going to run into. So since then, it's been studied really rigorously. It's been tested in all different aspects of healthcare, and there's data to support motivational interviewing and everything from developing study habits to brushing your teeth regularly, to better managing or diabetes and having better A1Cs. So it really has been extended to all aspects of healthcare. So, and another thing, while we're kind of talking about big picture stuff with motivational interviewing, it kind of loosely or fits into stages of change theory, or the trans-theoretical model of behavior change, what basically says that change exists on a continuum. And whenever, and the goal in motivational interviewing is to help somebody move around the continuum of change. So if you're meeting with a peer, it's very likely that at least they're already in the contemplation stage. They are aware that a problem exists. Maybe they don't know what they're going to do yet, but there's a problem and they're reaching out for you for help. That's kind of like where Alejandra was in that example earlier. And then somebody enters the preparation stage whenever they've got a plan. Maybe they haven't done anything yet, but at least they have a plan. And then once they start doing something differently, now they're in the action phase. And once they've been keeping that up over time, they're in the maintenance phase. And oftentimes, people will experience a relapse, and our goal becomes helping them get back on track as soon as possible. So like moving from relapse back into preparation or action, so that they can get themselves back on track as soon as possible. So that can be a helpful way to kind of think about, what your goals as a peer are to, kind of move people through this continuum of change, depending on what they want help with. So how do people typically try to help others change behavior? So, if you haven't done the kinds of training that you all have been doing, or maybe you think back to your own experience in life, how have other people tried to help you change behavior? What have you witnessed? Handcuffs, yeah, that's one way. Yeah, so shaming, punishing people. Okay, yeah, Sandra, you hang out with a good crowd. If there people are sharing their experiences and leading the way. Yeah, Leah says bullying. Yeah, the cringy kind. What I was doing earlier, bribing people. Um, yeah, so those are really common kinds of things. And once again, a lot of my experiences in healthcare, and we see the same kind of stuff. So maybe somebody has good intentions, they're giving advice, like I was doing to Alejandra earlier. Maybe I give them an order, say, you have to do this or else. Um, I think probably what we're like most guilty of in healthcare settings is like, oh, we just have to give them the right handout. If I just give them this information or this handout about why they need to exercise, then I've done my due diligence. And so we've got to get them that information. And, once again, somebody may not be ready for that. They may not care about it. But anyways, we miss the mark a lot of times in healthcare. Or maybe you try to scare them. That was like our handcuffs example. Or, maybe whenever we're more evolved, we provide empathy or support, and that can be really helpful. But once again, it may not be enough to help somebody produce change. Yeah, those are all really good examples that you all are coming up with. So we know what doesn't work a lot of the times, right? So I'm curious, what things have you found that have been helpful for you in helping peers or different friends, other people in your life change behavior? What do y'all think? What are the things that stand out to you? Yeah, being patient, asking what they could do differently. Yeah, maybe sharing your own story if somebody's ready for it. Yeah, sometimes giving facts, like I was talking about with that, like the origin or origination of motivational interviewing. Yeah, once again, sharing lived experience, being non-judgmental, engaging their interest. Yeah, forming a relationship with them. Yeah, those are all really good examples. So I think that one of the things that you all are getting at is some of the most important factors in helping someone change a behavior. So when we look at, what it takes for people to make serious behavior change, we really see some pretty common themes. And once again, I feel like a lot of what you all are saying is really consistent with this, but a slightly different way of thinking about it is intrinsic motivation. People change behavior because it's important to them in their own lives to do this. This is either helping them accomplish what they want to be able to do in their lives. It's helping them feel better in their day-to-day lives. It's helping them provide or spend time with their families. So we're really getting at what's important to somebody. And that's going to be individual for every single person. Everybody has different values. Sometimes extrinsic motivation. So like I'm trying to obtain some sort of reward or avoiding some sort of negative outcome can be helpful in changing behavior. Extrinsic motivation in and of itself is usually not enough to sustain long-term behavior change. But something like avoiding going to jail can be incredibly motivating, especially in the short term. And then lastly, so people have to be motivated to change, and they've got to have confidence in themselves in order to change the behavior. So these are like the two most important components. You've got to be motivated, and you've got to have confidence in your own ability to do that in order to be successful. So a lot of the things that you all are saying here, like silence and listening, positive affirmations, meeting people where they're at, helping them find resources. This is all consistent with helping somebody either find their own motivation for change or helping them build confidence in their ability to change. All right, moving on. So I'm 30 minutes into the presentation and just at part 2, so you're going to hear me talk real fast. So engagement and listening, which it sounds like you all have done a lot of work and these kinds of things before. Is that true? Do you all get practice and training in doing things like reflective listening and making affirmations and those kinds of things? Okay, perfect. You're like, Kyle, you're speaking our language. This is the stuff that we do already. You just call it motivational interviewing. Awesome. So some of the things that can really help people feel engaged, or if you're kind of like on the other side and you're meeting with someone and you're skeptical, it's like, here's this person, they're trying to help me, they don't know me. So this is kind of what would be going through my mind in those situations. Like, do I feel respected by this person? Does my peer support specialist, like, are they listening to me? Are they understanding me? Are they talking over me? Do they really care about me? Can I trust this person? Do I have a say in what we even talk about? Like in my earlier example, I was not respecting Alejandra. I was not listening to her. I probably wasn't coming across as being super trustworthy because I wasn't showing that I really cared about her. And I wasn't giving her a say in like how we were spending our time at all. So those are the wrong things to do. And once again, I think you all are pretty good at this naturally, setting agendas and letting people decide what they want to talk about. So what do you notice about peers that are actively engaged in their recovery? How do you know, or like, what things do you see in a person when you're like, this is going well, this is headed in the right direction? Yeah, they're coming up with their own solutions. They're engaged in conversation naturally. They're showing initiative, confidence. They're changing behavior. They're asking you questions. They're taking steps towards their goals. They're wanting to meet with you on a regular basis. Yeah, and asking for help and support. Yeah, they're eager to report back. Oh, it's so cool to hear these kinds of examples. Yeah, maybe you notice a change in how they feel about themselves. Yeah, maybe they even show empathy for you. That's a cool one. You model that, and then you see it in them too. So some of the things that I've heard before, and this I'm guessing y'all would agree with this. Feeling like you've got a mutually trusting and respectful helping relationship. You've agreed on what you're helping them with. Maybe you're collaborating, you're working together to help somebody reach their goals. So those, once again, are just kind of general types of things that you would see in somebody that was engaged in helping themselves. So here are some things to watch out for in terms of that could lead to disengagement. And so assessment-oriented conversation, like when you're just asking tons of questions, especially like closed questions or like yes, no kinds of questions, big turnoff, right? I know that I'm like the worst patient because I get really turned off by that very quickly. Taking an expert role and prescribing change, saying, I know what you need to do, just listen to me. That doesn't make us feel good. Premature focus, maybe you think you know what the person's problem is. And, like maybe like in my example earlier, like I'm telling Alejandra, like you just need to get back to work. And, maybe what's really going on is she's having a really challenging time in a relationship. And that's kind of underlying her depression and making it difficult to work. But I'm so focused on just helping her get back to work that I totally miss this issue about the relationship in her life that's throwing her off course. So once again, we've got to see what's going on for a person before we move to try to start helping them. Labeling people is like rarely helpful, which I'm really cautious about my personality disorders presentation later, but I'll talk more about that when we get there, because as you all know, actually I think, was it maybe Lisa somebody posted this earlier about sharing their own diagnosis and talking about how you don't have to be defined by your diagnosis. You're a person with a condition. You're not you're not like a depressed person. You don't want to use those labels. You're a person who's experiencing depression versus a depressive or something. Blaming people, y'all know that that's not helpful. Making small talk, chatting, people will do that when they're uncomfortable sometimes, but that's probably not going to help them that much. Yeah, and you all are coming up with some good ones here. Yeah, so stay in your lane. Focusing on the solution rather than the problem. Yeah, those can be helpful. Okay, listening. Well, you all know this because you do other training in listening skills. But how would you know if somebody is listening to you? How would I know if you're listening to me right now? Yeah, so people are asking questions. They're, responding. These are body language feedback. Yeah, these are all great examples. How would you know if you're listening to someone else? I know these are kind of dense questions. Yeah, you're quiet, you're listening, maybe you're making reflections. It's I think like probably the biggest thing that people miss is people will be contemplating like what they need to say next, especially, probably like when you're more nervous about meeting with someone and you're kind of planning your next step about what you're going to say, and you can get kind of stuck in your head. and you can miss out on what the person is saying. So if you can repeat back to them what they're saying, or you're thinking of like clarifying questions, those would be good indicators, that you are truly listening to someone else. So we can practice reflective listening to help engage with our peers, to help them feel understood, and also form an alliance with them. You'll feel connected to somebody whenever they're using reflective listening. Yeah, so Sean is doing doing what I do. I'm asking questions to see if you're still with me. Otherwise, people can get distracted pretty easily. Okay, so what do we mean by reflections? So the essence of a reflective listening response is a statement that makes a guess as to what a person means. So, you can literally repeat back to somebody what they said verbatim, and that's one way to do reflective listening. But we want to add a little extra insight into that, and where once again, we make a guess as to what a person's saying. And when you do that, that gives the other person a chance to clarify. They're either going to say, yep, you got it, or they're going to say, no, that's not really what I meant. It was this other thing that was really bothering me. So reflections can vary in depth. So once again, they can be these really simple reflections where you're just repeating back to somebody what they said, or they can be really complex too, where you're really saying, you know what, I hear what you're saying, and I think all this other stuff is probably going on too. So like with Alejandra, I may have said something like, yeah, it sounds like you're having a really hard time with your mood. I wouldn't be surprised if you're having a hard time in other relationships in your lives. I know you said that some of your friends aren't the best, or haven't been the most helpful people to be hanging out with, and that sounds really difficult, to not be able to turn to them when you're having a hard time. So I don't know that that's what's going on, but it's a plausible example of what was happening. And so once again, that would give her an opportunity to let me know if I'm on track or not. And so here's a really interesting statistic about motivational interviewing, is those that are really skillful in motivational interviewing they're using 2 or 3 reflections on average for every question they ask. But in normal types of settings, questions are going to outnumber reflections 10 to 1. So this would be like in healthcare settings, like where a doctor's asking a bunch of questions they're trying to drill down, to figure out a diagnosis on something. But once again, those that are really skillful in motivational interviewing are making 2 to 3 reflections for every single question they ask. So they're kind of using their question or their reflections in a way to get more information from a person without just straight up asking them another question, because it feels so much more engaging when you're reflecting on what somebody's saying and using your reflections to gather more information. All right, so moving on here to some of our other core interviewing skills and exploring values. So these are some things, that you can put in your toolkit. Once again, some of you all are already doing this already. It could be just a slightly different way of thinking about things that could be helpful to you. So our core interviewing skills are represented by the acronym OARS. That's why I've got these OARS here on the screen. So the O stands for open-ended questions. We've already been talking about those today. Making affirmations or affirming your peer. Y'all have been using that as an example today of what helps you feel connected to folks. Using these reflections that we were just talking about. Their active listening skills. And then also using summarizing statements, which are a lot like reflections, but they tie together lots of information. So let's look at these all a little bit more specifically. You all noticed this earlier whenever I was doing my interview. Like, I was asking all these closed questions, and when I switched gears to more of a motivational interviewing type approach, I was using lots of open-ended questions. So probably one of the main reasons to ask open-ended questions, it shows that you're really interested in what somebody has to say. You're not assuming you know what's going on with them. You're asking and you're showing interest. You also can get a lot more information from somebody whenever you ask open-ended questions. My favorite example from the dentist office is, like the dentist or the hygienist will ask you, like, so are you flossing every day, or something like that, or you're brushing twice a day, right? Versus, think about the response that you would give if they ask you that, versus if somebody said, can you describe your dental hygiene to me? You have to describe exactly what you're actually doing. You probably would end up with some different answers in those different situations. So once again, you get so much more information whenever you use open-ended questions. And once again, those closed questions can be really disengaging, and you could easily miss out on important details about somebody's situation. All right, so moving on to affirmations. So affirmations recognize and acknowledge that which is good, including the individual's inherent worth as a fellow human being. Making affirmative statements like just feel good. And it's a great thing, to be intentional about with anybody that you're working with. So affirmations provide support and encouragement. And something to think about is good affirmations are not just praising, and they typically start with using you and not I. So instead of saying, like, I think you've been working really hard on this, and I'm proud of you, or something like that. I may say, you've been working super hard on this. It's really cool to see that you're doing that. So I'm just saying what the person is doing and talking about how that could be helping them. And I'm not saying I think this or I think that, because I don't want it to come across like I'm judging the person. Does that make sense? Once again, you all are probably naturals at this, but just reflecting what the person is doing, saying what they're doing, is going to give it a different feel than if you're saying, I think this or I think that. All right, yeah, 15 minutes. I'm moving quickly, Alejandra. Okay, and then summary statements. So summaries are reflections that pull together several different statements that a peer has made. So summaries allow someone to focus on the peer's strengths and highlight specific aspects of the conversation. So this is really, this takes more skill. People have to be thoughtful about this. But basically, like, when I make summary statements, I want to really focus on the things that I want to highlight that the person has said. I want to comment on the positives, the things that people are working on. I want to focus on, well, as we'll learn in just a second, their change talk. So summaries allow us, or allow our peers to hear their experience in a more comprehensive way and see the big picture about what's going on. And I want to highlight the important parts of the big picture whenever I'm making summary statements. I don't want to highlight why it's going to be difficult, or the problems that somebody's having, or why they wouldn't want to do something, or what they did in the past. I want to focus on the goods, or the things that are going to help them move forward. And then lastly here, exploring values and goals. Understanding someone's values and goals is essential to knowing them. Once again, y'all are doing this pretty naturally, but if you can truly understand, what is driving a person, what's important to them in their lives, what their hopes are for themselves in the future, how they want to be spending their time, then you can help them come up with plans to do what they want to do. But oftentimes we just skip right past that. We assume that we know what people want, and that's, we're doing them a disservice if we do that. And oftentimes people are living inconsistently with their values and long-term goals. They're making choices, that are not leading them to what would be most important. And when we're thinking about using motivational interviewing, we kind of want to subtly help them identify the discrepancies between what they're doing. Maybe they've got a goal to save up money to be able to buy their own place someday or something, but they're spending their money on fancy coffee every day or something. So if you could help somebody realize, how they're spending their money in one way and how this could potentially take them further away from their long-term goal, those are the kinds of things that we want to bring to someone's attention, but by allowing them to discover that themselves. All right, now to our last part, and this is really kind of at the heart of motivational interviewing, what we're trying to get our peers to state. The goal of motivational interviewing is to help somebody resolve ambivalence, and we help them resolve their ambivalence by producing change talk, which we'll talk more about in a second. So when we say ambivalence, we're talking about the state of having mixed feelings or contradictory ideas about something or someone. Like, I know I got to go to work, but my bed feels really good today. Like those kinds of things. And for the sake of time, I'm going to skip over examples, though I'd love to hear yours. So yeah, I'm sure y'all are constantly running into different types of ambivalence when you're working with peers. On one hand, it's easier to do this, it's familiar. On the other hand, these other kinds of changes could really help somebody get to where they want to be in the future. And you're trying to kind of lay all this out on the table for them so that they can see things more clearly and make a choice about what they want to do. So my mouse is finicky. Our goal when using motivational interviewing is to help patients explore and resolve their ambivalence about change by eliciting change talk. My goal is to help them talk about how they want things to be different for themselves in the future and how they're going to do that. So change talk is any self-expressed language that is an argument for change. This is like motivational interviewing gold. We want to get as much of this as possible. We want change talk coming from our peers, coming from our patients, in my case, because that's what's going to get them to actually change. So the different types of change talk to look out for. So there's preparatory change talk. So people are talking about why they want to make changes. They're talking about how they're going to make changes. They're stating reasons why they need to change. They're literally saying, I need to do this because of this. There's some overlap there between these things, but we need to dispel darn. So we've got a nice acronym. So once again, we're looking for desire, ability, reasons, need, and also different types of mobilizing change talk. So we're talking, people are making commitments to doing things. You're seeing activation. They're literally doing things that are helping them accomplish what they're working towards. In contrast, sustained talk are stated reasons not to change or to maintain the status quo. So these could be like barriers that people are coming up with. They're talking about what they're getting out of their current situation. And our goal in motivational interviewing is to steer people away from saying sustained talk and toward change talk. We know that behavior change is directly associated with increased change talk and decreased sustained talk. So in these studies of motivational interviewing, they'll record the entire conversations and transcribe them and rate how many times somebody uses change talk in the conversation, how many times they use sustained talk in the conversation. And we know that whenever people are using more change talk, that is predictive of their behavior change. So the more they're talking about changing, the more likely they are for that to become a reality. So that's what we're trying to get from our peers. So evoking change talk. We want to use our questions and our reflections to get somebody to produce more change talk. So once again, this is silly, but you can keep the darn cat: desire, ability, reasons, need, commitment, activation, taking steps. And you ask questions that address these areas so that your peer is responding with statements that would be considered change talk. So what are some things people can do to evoke change talk from their peers? Well, you can ask about extremes. You can say, well, what are the worst things that could happen to you if you stay like this? What are the best things, that could happen to you if you were able to make these changes? You can look into the past and the future. How do you think you would feel if you were able to accomplish this in the future? How would you feel about yourself? Like that can be really motivating for folks. You can talk to them about their goals and values, what they hope for, what's important to them in their lives, and why making changes now will help them live consistently with what's important to them. Another strategy from motivational interviewing that people, this is like one of the things you can tuck in your back pocket, use an importance ruler where you can say, how important is it to you? So I'm like, Alejandra, how important is it to you on a 0 to 10 to keep your job right now? And regardless of what she says, I would say, well, why did you say this and not a lower number? So why did you say a 7 and not a 3 or a 4? And when she answers that question, she's going to tell me why keeping her job is important to her. And so once again, you can use the importance ruler to help you get more change talk from this person. Yes, you could ask somebody like, what does change look like for you? Like if you were, once again, we'd want to know specifically what the person's trying to work on. Maybe you're trying to help them get help for their depression. And, so you say, like, what do you think this would look like for you if you were getting help for your depression? What would that look like? And maybe they say, you know what, I need to meet with a psychiatrist. I'm tired of riding this roller coaster. I need to talk to a psychiatrist. I need to meet with a therapist. And so those would be examples of change talk about getting help for managing depression. And you could say, how would behavior X affect Y? How do you think talking to a therapist could help you keep your job? And then they would say, well, if I had somebody else to talk to, maybe I could get some different ideas about this or that. And so once again, you're producing change talk by answering these kinds of questions. So once you're getting a lot of change talk from someone, so you see they're making these darn statements. You can tell that they're moving from contemplation to preparation. Now we know that it's time to help them move on and come up with specific plans. Maybe you're also hearing mobilizing change talk, and they're telling you what they need to do. They're like, you know what, I'm going to call Access Behavioral Health after our meeting today. That would be a commitment, to doing something to help themselves. Maybe you're not hearing as much sustain talk anymore. They're not telling you about all their negative past experiences in therapy. They're kind of moving past that, and they're talking about how it could be helpful. And sometimes you'll see this like sense of resolve, like for somebody just kind of, they just come to terms with what's happening. It's an interesting thing to witness, and I'm sure you all have seen it before too. But somebody's just kind of coming to terms with it. They're recognizing they've got an issue and that it's time to do something about it. And that's pretty fascinating how that clicks, and you can see it happen sometimes. Maybe they're talking about what they want for themselves in the future. Maybe they're asking you questions about change. So whenever you're seeing this stuff, that's your indicator that it's time to move on. And so when you get to this point, one of the really helpful things you can do is this is a fancy thing to say, a recapitulation, transitional collecting summary of all the change talk that your peers provided thus far. So I may be like, Alejandra, when I first got here, we weren't sure exactly, what you wanted to do to get help for your depression, but you said you wanted to meet with a therapist. You said you wanted to meet with a psychiatrist. You said it'd be a good idea to get back into a 12-step program. It sounds like you're really ready to make some changes in your life to help yourself get back on track. So I'm taking those like little bits of change talk and presenting it back to somebody. And I, think about that sometimes, like picking flowers and putting them in a bouquet and presenting it back to someone. And then you say, so, after you've said all this, what's the next step? Where does this leave you? And I want them to start coming up with a plan for themselves about what they're going to do, without passing judgment or telling them what to do. And that's a tricky thing to watch out for. Okay, so things to do, like when you get to this point, watch out for the writing reflex. You're like, finally, I can tell them what to do. No, don't do that. Still let them come up with their own reasons for change. Watch out for sustained talk. If you start getting ahead of the person, you're likely to see more sustained talk, and you need to back up and use some of your key interviewing skills, or back to those ORs statements. So try not to get ahead of them, and let them come up with their own plan. Once again, goal is to elicit the plan from them, not from us. So once you get to this point, you can start helping them set goals. And I'm gonna, it's 3:28. I only got like a minute left. I've got a couple slides left here about, how you can help somebody set goals. This isn't necessarily a part of motivational interviewing, but it's how I try to help somebody set goals. So I'm gonna go very quickly through this stuff. But things to keep in mind: short-term, mid-term, intermediate, long-term goals. Helping people set goals that are smart, so that they have a good plan to accomplish what they're setting out to do, or things that you can be mindful of when you get to this point. We want to help people set goals that help them get a sense of success and support self-efficacy. Like with Alejandra, I may have her make the phone call instead of making a phone call myself to the clinic, so that she can feel good about that. And set goals that are accomplishment and are pleasure oriented, just to help people feel better about themselves. So maybe have you all seen the SMART goal criteria before? Some of you probably have. Okay, yeah, so this is just a great framework for yourself or anybody you're working with to set good goals. So they're specific, measurable, attainable, relevant, timely. Could say a lot more about that, but I'm out of time. And then scheduling activities. And once again, this kind of goes back to SMART stuff, but you're just trying to do like the nuts and bolts of saying, like, when are you going to do this? And helping people put it into a schedule or a plan to make it more likely that it's going to happen. You can break it into small. Oh yeah, you can cut me off, Alejandra.
No, I wasn't sure if you were finished. I was going to say, since you are presenting our next session, I'm okay with you going over a couple minutes if you need it.
Okay, yeah, I'm like 1 or 2 slides left, I think. So if you're running into problems with the activities, you can break them into smaller steps if you need to. Think about what they need, how will they get there. You're kind of thinking ahead for them and different problems that they could run into, and just helping them out. Once again, this is kind of detailed stuff. Oftentimes people are going to be able to do this on their own. So in review, the 4 main processes of motivational interviewing: engaging, focusing on a specific thing that you're trying to help them with. That's easier said than done sometimes. Evoking, getting change talk from the people you're working with. And then, once they're ready to make a change, then you start talking about planning or how they're gonna do that. So some people are talking about longer sessions. So I'm not quite sure about Casey's comment. Like, would you do this the entire 2 hours? Is that how long you're typically meeting with someone? Or are you saying like my presentation that's 2 hours? So the way to think about motivational interviewing, it's hard to put a time frame on motivational interviewing itself. It's really this kind of like spirit of interacting with someone. And I think probably, once again, because you all are just like naturally good at forming relationships with people and being really good listeners, and you're practicing those kinds of skills, probably the main takeaway for you all when thinking about motivational interviewing is this idea of getting change talk from the people you're working with, getting them to come up with their own ideas and plans, and talking about why they want to change in their lives. And you can use those, listening skills, conversation skills that you already have to help get them to express change talk. All right, so I will monitor the chat box now and answer any questions. If you need to go to the bathroom, drink some water, go for it. We'll switch gears here in about 10 minutes, and then we'll talk about personality disorders. Yeah, very, very, that'll be fun because it's a total switch.
Yes,
Okay, Casey, yeah, you're meeting 2 hours with them, I see.
And just a reminder, folks, that will be a new link for that presentation that's coming up. So it's a different one, but we'll still be with Kyle.
Yeah, good points that you all are making. So you're telling me your meetings are 2 hours. And so, yeah, just like Brandy pointed out here, it's a style of interacting with someone. So it's not like you do motivational interviewing for the next 30 minutes and then you do something else. It's the way you're thinking about your entire interaction with them. So yeah, it's really a spirit, and that's a hard thing to explain to somebody, but I think you all get that. It's how you're thinking about the person, how you're approaching working with them, and letting go of your own agenda and really showing up for that person to help them with what they want help with, which, I think that's probably how you all are approaching your work already. Yeah,
Right.
Casey, it's more of an attitude than a technique, though there are specific techniques that are consistent with motivational interviewing. Yep, that's a good way to think about it.
All right, lots of thank yous. So I will give folks a break, 10 minutes before the next session starts. So we'll see you all soon.
This is for you, Brandon.